Hi, I'm Jasmine, and today I will be discussing my position on abortion. According to Jones and Kuistra, authors of the article, Abortion Incidents and Access to Services in the United States, 2008, the estimated number of abortions in the United States totaled 1.21 million. In other words, per 1,000 women between the ages of 15 and 44, 19.6 abortions were performed. Are you a woman that has personally experienced abortion? Or are you a woman that is possibly considering terminating a pregnancy? Before making a final decision on whether to terminate an unintended pregnancy, consider the physical, mental, and moral consequences that are involved in the process. I have never personally experienced an abortion. However, I have interviewed friends that have made this decision. Likewise, I have rigorously researched this issue. Abortion should be illegal in the United States because of the detrimental physical and psychological consequences that it poses. The government does not mandate reporting of these terminations, and among other reasons, the fetus has constitutional rights just as we do. To fully grasp the profane nature of abortion, one must take a moment to briefly discuss the historical decisions that legalized abortion. As stated by Dr. John M. Thorpe, Jr., author of the article, Public Health Impact of Legal Termination of Pregnancy in the U.S. 40 years later, the course of history was changed when the United States Supreme Court ruled in the favor of lifting restrictions on terminating pregnancies in both court hearings Roe v. Wade and Doe v. Bolton. The sociocultural effects of legalizing abortion in all 50 states has caused a paradigm shift in the United States as well as for women and families. Since the Supreme Court ruling, access to getting the abortion procedure done has increased rapidly, encouraging a surge of abortions at a significantly higher rate than expected. An estimated 50% of women in the United States will have an unintended or unplanned pregnancy, and nearly half of those will be aborted. According to Dr. John M. Thorpe, Jr., writer of the article, Public Health Impact of Legal Termination of Pregnancy in the U.S. 40 years later, between menarche and menopause, in the U.S., 1 out of 3 women will undergo TOP, or termination of pregnancy. This makes TOP one of the most common medical interventions. Although abortion have become one of the most common medical procedures, research has suggested there are several physical and psychological implications resulting from the procedure. According to Dr. John M. Thorpe and colleagues, authors of Long-Term Physical and Psychological Health Consequences of Induced Abortion, review of the evidence, previous abortion was associated with increased risk of preterm labor and later pregnancies, placenta previa, and mood disorders. In the words of Dr. John M. Thorpe and colleagues, preterm delivery and depression are important conditions in women's health, and avoidance of induced abortion has potential as a strategy to reduce their prevalence. Studies have suggested that the effects of mood disorders following an abortion can be severe enough to evoke self-harm. According to Priscilla K. Coleman, author of the article Abortion and Mental Health, Qualitative Synthesis and Analysis of Research published 1995 through 2009, women who have had opted for an abortion was at an 81% increased risk for mental health issues, and an estimated 10% out of this group directly associated their mental health issues to the abortion. When compared to women with long-term pregnancies, women who decided to terminate the pregnancy had increased risk of substance use disorders and suicidal ideation and behavior. According to Dr. Linda A. Bartlett and colleagues, authors of Risk Factors for Legal Induced Abortion Related Mortality in the United States, an epidemiological study was conducted to assess the number of deaths related to complications from induced abortions. 700 per 100,000 induced abortions resulted in death following complications in 1988 to 1997. Risk of death increased significantly, up to 38% with each subsequent week of gestation. Induced abortions done in the second trimester were more likely to die, relating to complications of the termination. For instance, at 13 to 15 weeks gestation, the risk of dying from abortion-related causes was 14.7%. which rose to 29.5% at 16 to 20 weeks and 76.6% at 21 weeks and after. As stated by Dr. Linda A. Bartlett and colleagues, causes of abortion-related deaths included direct causes, vaginal and intra-abdominal hemorrhage, infection included endometriosis, septicemia, and other infections, emboli including thrombotic, amniotic fluid, and air emboli, complications of anesthesia, and indirect causes, mainly cardiac and cerebral vascular events. Although serious consequences, including mortality, can result from abortion, still there is no mandatory reporting and low monitoring of facilities that offer these services. According to Dr. John M. Thorpe, Jr., author of Public Health Impact of Legal Termination of Pregnancy in the U.S. 40 years later, unlike other countries, the United States does not have a formal systematic system of keeping track of abortion procedures. In the words of Dr. John M. Thorpe, Jr., termination of pregnancies or TOPs are not registered by the government, and there is no mandatory reporting, so the true incidence cannot be ascertained. There are two unreliable sources that the United States utilizes to obtain induced abortion epidemiology, which include a survey given out by Guttmacher Institute and the Abortion Surveillance Report compiled by the Center of Disease Control, or the CDC. Surveys conducted by the Guttmacher Institute are voluntary and are done at various irregular intervals. Some of these surveys have up to 5-year gaps since the last report. The Abortion Surveillance Report is based on states that have voluntarily reported induced abortion rates. However, several states like California have not reported this to the CDC for the last decade. According to Clark D. Forsythe, author of the book Abuse of Discretion, The Inside Story of Roe v. Wade, by striking down the abortion laws of all 50 states, the justices created a public health vacuum that they could not fill. Since the Roe decision and no governing laws to properly monitor induced abortion practices, there have been numerous clinic scandals in several cities, including Philadelphia, New York, Chicago, Phoenix, and Los Angeles. Dr. Kermit Gosnell's clinic in Philadelphia was investigated by a grand jury in November 2009 and subsequently charged for multiple homicides resulting from malpractice while conducting induced abortions. Dr. Kermit Gosnell's Philadelphia clinic was in violation of many health and safety violations, like, for instance, aborted infant body parts stored in jars, bloody floors and equipment, and other unsanitary conditions. Between the years of 1983 and 1984, the state of California had at least 5 deaths resulting from induced abortion complications. However, these were not even reported. According to Rachel Schultz of American Healthline First Look, and author of the article, Senate Blocks Bill to Ban Abortion After 20 Weeks, Fast Tracks Other Anti-Abortion Measures, in 2015, videos were released exposing Planned Parenthood providers discussing illegal fetal tissue donation, spurring the Senate to halt all federal funding to the group for 1 year as investigations ensue. With all the scandals surrounding induced abortion, the United States Constitution has a duty to protect the rights of human life, including a developing fetus. According to Randall A. Lake, author of the article, The Ethical Framework of Anti-Abortion Rhetoric, there are certain moral laws that are upheld by the United States Constitution. The moral laws prohibit certain acts like murder, and any violation of these laws are wrong. As stated by Randall A. Lake, the fetus is allegedly a person with a right to life, granted by our moral tradition and by the Declaration of Independence and the Constitution. In the words of Edward Bowen, Massachusetts representative, we are depriving literally millions of human beings of life. As stated by attendees of the United States Catholic Conference, declares that no moral principle can equitably and justly balance the potential accomplishment of social goods with the direct and deliberate destruction of 1 million or more unborn human beings each year. In conclusion, The Roe v. Wade and Doe v. Bolton Supreme Court rulings have created a public health vacuum that is under the radar, encouraging abortion clinic scandals and illegal practices on various levels. The overall public health impact that abortion creates, including physical and psychological problems, need to be addressed to increase awareness of these detrimental consequences to women considering abortion. According to Denise Boyd and Helen B., authors of the book The Developing Child, by 10 to 14 days, the implementation process has already formed the embryo and supporting structures, and by week 4, the heartbeat is actually detectable. The human embryo is a developing human with a right to life that is upheld in our Constitution and Declaration of Independence. It is our duty to abide and protect the constitutional rights of all human beings, including the unborn human fetus. So, I call a rise to action to end abortion laws in all 50 states. Thank you.